Hello, and welcome to our webinar, How Technology is Driving the Future of Brain Health. My name is Rachel, and it is my pleasure to be your moderator today. On behalf of Brain Injury Canada and our presenting partner and platinum sponsor, VoxNeuro, I would like to say thank you for being here today. VoxNeuro is a neuroscience company that is committed to improving brain health through data-driven results and technology that can inform treatment. We thank them for being such an involved sponsor and for participating in this webinar today. Before I introduce you to our esteemed speakers, I did want to go over a few Zoom webinar features. First, we are recording this webinar, and it will be made available for all at a later date. Secondly, at the end of the panel discussion, we will have a question and answer period. Anytime during the presentation and the panel discussion, if you have questions, at the bottom of your Zoom screen, you will see a Q&A box. Please type your questions into this box. We will endeavor to answer as many submitted questions as we can during the Q&A period, time permitting. Now, it is my pleasure to introduce our panelists today. Dr. Kyle Reiter is a neuroscientist responsible for VoxNeuro's standard of care for patients. This role includes oversight of the research and development, clinical operations, and regulatory affairs and quality assurance departments, with a focus on product development and expanding the medical applications of VoxNeuro's technology. Dr. Lauren Karatanevsky is a co-founder of the Back in Action Health and Performance Center. With over 2 decades of experience in exercise and sports science and high performance, she runs a state-of-the-art facility that helps individuals increase their performance through innovative technology and data-centered testing systems. She aims to change modern medicine by providing unique brain and high-performance assessments that do not just provide objective data and results, but are used to create comprehensive plans to better inform treatment and rehabilitation strategies, prevent injuries, and elevate performance. And last but certainly not least, Dr. Dr Rathbone is a neuroscientist and a neurologist. He is a tenured full professor in the Department of Medicine, Division of Neurology at McMaster University. He runs an active neurological practice and has treated over 30,000 patients with various neurological problems, including over 5,000 patients who have had neurological trauma, including a range of behavioral problems such as post-traumatic depression and post-traumatic stress disorder, as well as chronic pain and its effects on cognitive function. I'd like to thank you all so much for being here. And without further ado, I will turn the discussion over to the experts who are assembled here today.
Awesome. Well, thank you very much for the intro there. Very happy to be here and excited to run this discussion with all the viewers that are on here today. So again, my name is Kyle Reiter. I'm the VP of Clinical and Scientific Affairs at VoxNeuro. VoxNeuro, what we have is a cognitive health assessment to help provide better objective data of an individual's cognitive health and help them in terms of the entire rehabilitation and recovery path. And the data that we provide is really to be given to the 2 other clinicians here, Dr. Karatanevsky and Dr. Rathbone, to help them make better decisions with their patients, and ultimately be an additional tool to help guide the entire rehabilitation process and help an individual get back onto the path to recovery sooner, back to play, back to work, whatever it may be. So I think firstly, after a little bit about me here is I'd like to get into first, Dr. Karatanevsky, what is the practice that you run over at Back in Action? What's the type of technologies that you utilize today? What's your background, et cetera? So if you can give just the audience a little bit of context as to what it is you do and what your practice does.
Absolutely. Thanks, Kyle. I'm so happy to be on this webinar today. I think this is such an important topic, and it's really nice that we can come together as a group to discuss. A little bit about me. I was an Olympic level athlete. I was a springboard diver. I had gone to several world championships, and my last go at my sport was in Beijing when I went to Olympic trials there. So sport and high performance and brain health has been really my life for several years, decades actually. So when my husband, Scott, and I opened up our clinic, Our focus has always been an outside of the box approach. We have a multidisciplinary clinic in Toronto. We also have one in Oakville. And we really use our background, my background and his background in athletics, to really think outside the box. And this is where we came to understanding how technology is so prevalent in the world, and where it was missing in medicine. And we used that and saw that gap and used technology like the VoxNeuro cognitive health assessment and some other tools that we have in our office to really help us objectively quantify what is happening to our patients so that we can provide better care and better strategies for them moving forward, which was very important to us. And it's been excellent. It's been a lot of fun. Our treatment strategies have changed. They're so different than what they used to be before. They're still very hands-on, but with a little bit of a twist. So we have a lot of fun in our office now using the technology that we use. And then, like I said, again, thinking outside the box and using different strategies to help and assist our patients, improving upon their brain health, their function, their day-to-day function and day-to-day clinical activities, and as well as any other goals that they have with respects to their health.
I love the little slide in of I was an Olympic athlete. Yeah, no biggie, but very awesome and very cool.
Long time ago.
Yeah. Nonetheless, so again, essentially, Dr. Rathbone, the same question: what is your practice? What are you doing with your patients at your practice, and et cetera? So take it away.
Okay. I think I should just add in yes, I was also involved in track and field at university at the national level, and then I was one of the people who was perhaps instrumental in setting up the Coaching Association of Canada and the Track and Field Association coaching, and in fact hired the first professional coach, Gerard Mack, many years ago. And since then, many things have changed. So I'm a neuroscientist, I'm a neurologist. Neuroscience covers a whole broad spectrum. So I'm more on the biochemical, pharmacological side of neuroscience than on the electrophysiological. Now within my practice itself, my predominant practice is now seeing patients with neurotrauma. So this predominantly involves head injury, and of the head injuries, then I would think over 90% of the patients that I see as outpatients are those with what we call concussion, the mild traumatic brain injury, not the more significant brain injuries with parts of the brain obviously missing, which we see as inpatients, although I saw one of those this morning as an outpatient. So my biggest problem is how do I look at these patients? So I look at them as with their symptoms, their patients, each separate, each individual. And so there are no two concussions alike. There's no remedy for concussion. One has to take each patient individually and then work with them. One finds out what's wrong with them, and that's where the technology comes in particularly, and then one treats them, and we have new technologies to treat them. So I think the thing is that we have had VoxNeuro in the office, and now we're running with this. We find it's very helpful. It gives us a good indication for the treating health professionals to work with the patients on certain areas of their cognitive dysfunction, and this has been very helpful. It's also, I think, very helpful in demonstrating. We've had a couple of patients from lawyers who found their clients were being rejected because they don't have anything wrong with them. And by showing them the VoxNeuro results as well as our reports, then this at least shows that there's something wrong with the brain. It doesn't show it's a brain injury, but it shows that the brain is certainly not working. And so it is quite wrong to say the brain is normal. So that's the sort of thing I'm doing from the diagnostic point of view. From the treatment point of view, we've done some repetitive transcranial magnetic stimulation as research. We're now setting up that as treatment, and we're also using a green LED 525 nanometer therapy for patients with headaches, which we're finding when associated with other treatments together works like gangbusters. So that's me and that's us.
Oh, it's really cool. It's really nice to see, technology being adopted into clinical practice, whether it's from a more multidisciplinary approach or is it from, the neurology approach. So, which is great to see. This is very much a broad question to be asked, but I mean, again, this is just to kind of facilitate some discussion, but especially with some of the points that you touched upon, Dr. Rathbone, is, but how does technology change the way that we are currently, or the way that was previously being done to assess brain injuries? So I think we've all been doing this for quite a while, and even in the last 5-10 years, things have changed drastically. So I think, again, we'll start with you, Lauren. What has changed over the last, let's say, decade or so that has gone into your practice to help improve the treatment and assessment of those suffering from brain injuries?
I think for us, Dr. Rathbone touched upon it. We're changing what was once subjective, and we're now making it objective. And that for us was a massive shift. We as well are concussion certified. We specialize in concussion management and care through an organization called Complete Concussion Management. And what my husband and I realized was everything that we're doing, there's a subjective account from the patient to us. We take that information in and we subjectively give them information out. But there was a massive gap. We were able to help them with a lot of their physical complaints. But a lot of these cognitive complaints that they would present to us with, we had no idea how to go about navigating through that part of their care. And so we saw that there was a gap. We saw that there was this subjective communication, subjective analysis. It was really our personal opinion based off of who we saw in our practice. And we felt that it was really necessary to create an even more individualized approach.
We got there.
Yeah, I finally, good. An individualized approach to be able to help these individuals, because that's exactly what it is. No two head injuries are the same. No two people presenting to the office are the same. So we can't treat them in the same way. So bringing on something, and we ourselves have the VoxNeuro cognitive health assessments in our office, we were able to then say, this is who you are as a person. This is how you are presenting to us at this given point in time. And now it's up to us to find really great strategies for you that are so for you and not for anybody else, that we're really starting to see a massive shift. We're starting to see that people are getting better because we're not putting people in a box in terms of how they're going to go about being treated. One person may need one thing while another person needs something completely different. And we're starting to see a massive shift in not only our care, but patient compliance. Patients of ours are really so appreciative of that individual approach because they know they're not getting it somewhere else. And they know that they're not boxed in with everybody else at the same time too. So we've seen a massive shift in the sense that we're able to take that objective data and we're really able to put to the test in terms of, and especially in our office, our different rehab strategies that we have that are specific to that person and what their needs are at that given time. The beauty behind it as well is the fact that we now have more ownership of what we're doing as practitioners. So if I'm not doing something correctly and I do a reassessment to see how someone is progressing, that objective reassessment is going to tell me whether or not I'm doing a good job or not, or whether or not the patient is compliant or not. So now I'm comparing objectivity to objectivity rather than subjectivity to subjectivity. So there's really, I want to say I took the guesswork out of what I would have been guessing about, or what we all would have been guessing about in the clinic. So we're really able to streamline the approach to care that we want. Ultimately, we want to make sure that everybody gets better, or at least is living the best life for themselves, and whichever that may be. So we're better able to co-facilitate.
Right. And look, Dr. Rathbone, I see you leaning in there. It feels like you have a couple of comments to make, so I'm interested to hear what you have to say as well.
No, I'm absolutely with Lauren. I think that it's very important, this individualization of treatment. And the thing that has changed over the years is, instead of using a rather difficult and very expensive neuropsychological test, we can now, and you aren't going to repeat that several times at the cost it is, and taking a day or two out of a person's life, but instead we can get a very good idea of the brain function itself. We're looking at the electrical activity in the brain, we're looking at things that are happening in real time in the brain. And this makes it much easier for us to be able to determine which components really one needs to concentrate on. So that's just a huge help, and it's so different from, as you said, 5 years ago, and certainly it's very different from 15, 20 years ago.
Yeah, and I think one thing I'd like to add on is, we often drill into people's heads, the idea of objective versus subjective, and we've had great objective measures of structural integrity of the brain for a number of years. I'm sure, Dr. Rathbone, you've utilized or looked at, I should say, a number of different CT or MRI scans over the years. And these are incredibly great tools when it comes to understanding if there's something, significant in terms of, as you mentioned earlier, missing part of your brain, or whether it's, there's a tumor or there's significant atrophy. So essentially, the reduction of brain tissue. And what we are now providing today from a cognitive health assessment perspective is that ability to add that objectivity, but not from the structural point of view, but rather from that functional point of view. So now clinicians like Dr. Rathbone and Dr. Karatanevsky together can utilize not only information from, if required, of course, for the patient, that structural component, but also that functional component to provide a more holistic understanding of the patient's brain health. And it's still important to note that, even on the self-reported batteries, these are still very vital to the overall, clinical path for a patient. We want to know how you, the patient, are feeling. That is very relevant, very important, and it helps us, get a starting point of where to move towards. And it's then adding on these additional tools that will be able to help have a better understanding from a biological perspective, the level of your brain health or health in general, depending on what the ailment is. So I just wanted to point that out as well. And hopefully I didn't misspeak, as these two are clinicians, I'm a scientist, so if there's anything incorrect there, feel free to tell me that I'm wrong, but not sure if you have any other comments on that, Lauren or Michelle.
Kyle, I can jump in. I was going to say that I actually wrote a note for myself that says helps give a big overall picture, and that's exactly what it's really all about. I didn't mean to discredit any kind of subjective analysis from a patient or our own subjective analysis as a practitioner, but what I do feel it has done is exactly to your point. we are now able to use all of the information that we've been given, plus add more to be able to enhance one's care. And I think that is so important. I said to a patient not long ago, I said, we have self-driving cars. There's no reason why in the field of medicine, we shouldn't be able to have that innovation and that technology drive what we're doing at the same time as well. We can get there. I just think that it is taking a little bit longer because we have been so focused, comfortable in the strategies that we've done in the past. But it's amazing for companies like VoxNeuro to come out and showcase to us that there is more that we can do. And to Dr. Rathbone's point, not everybody's going to go in for a neuropsychological exam because they are incredibly expensive. They are incredibly difficult mentally and physically on the patient. We've had several of them do it and they're exhausted by the end of it, which then not only hurts them in the long run, but hurts us in what we want to get across for them too, because they're so physically taxed by the time they've come back to us. It feels like we've taken a couple steps backward in their care before we move forward again in their care. So like I said, again, I think it's created an amazing big picture where we can use all of the tools that we have now to be able to focus and guide better treatment strategies going forward.
I think that's very good. If I could also add in something that I think is very important that we've not really addressed, is that the fact that MRIs are fine if you have, as you said, Lauren, a tumor or a stroke or something, but in no real simple concussions, as opposed to concussions that cause blood inside the brain. But the simple concussions do not show up on a standard MRI, whatever sequence you use. Functional MRI may help, but there are huge amounts of problems and cost. This will show circuits and changes in circuits, but it really is not a mature technology. And the other thing is, however, that many patients who see me in my clinic are referred with concussion, and they don't appear to have had a concussion, they appear to have had a systemic injury. And we've just submitted a paper on this, supporting the work done in 2008 by Mears in Australia, whose group looked at patients who had concussion and patients who had systemic injuries and found that the post-concussion symptoms were the same. And we proposed that inflammation is one of the major factors. We know inflammation occurs after concussion. We know inflammation occurs after systemic injury. We know that each of the concussive complaints can be mimicked by increases in a couple of particular cytokines, the inflammatory proteins. So this is also very important. And it's important because that alters the ability of the nerve cells to communicate with one another and communicate with the supporting cells, but it cannot be seen on MRI. Where it can be seen is in VoxNeuro, because you see the neurons are not communicating. And that's where VoxNeuro has it hands down.
Yeah, absolutely. And I think that's a great explanation of that. And, that to your point between, the type of injury that results in the same type of inflammation, the same type of symptoms for a patient, look no further than Sidney Crosby. He is a perfect example of an individual who, yes, did sustain a concussion as well, but his long-term prolonged issues were not due to, quote unquote, the concussion. It was due to the neck injury that was associated with the concussion at the time of the injury, right? So it just goes to show that there are other components that can result in this. And to your point, Michelle, that we have to address both and ensure that we are looking at both aspects. And one of the ways to determine that, of course, is utilizing that VoxNeuro technology as well. But in addition to understanding that if a patient goes for a CT or MRI, in 99% of cases, as again, you point out, Dr. Rathbone, you're not going to see any issue with somebody who's had a concussion, unless it's more significant. So, and it's good that we point that out, because I think still there's some, for lack of a better word, misinformation on understanding that, if you have a concussion, go get a CT. Well, you're really not going to see anything, unfortunately. But that is still kind of the standard protocol in a number of places. So hopefully we can continue to change that perception nonetheless. Okay, I'm going to just kind of switch gears here, as I think we're coming in about 14 minutes left of our actual discussion panel period. One of the questions that I've been asked to ask is, are individuals able to access their own results and to have ownership over them? So I think we can say this more broadly. I can speak to obviously the VoxNeuro side, but even just the other types of assessments and how again, essentially their data is utilized in clinical practice as well, because I'm not familiar with that side. But from VoxNeuro's perspective, yes, absolutely, you can always have access to your data, and your healthcare professionals will always have access to the data as well. It's actually required by law that we provide the clinicians with access to the data for a certain number of years. So of course, we always can do that. So it's your data, you can always have it, and you can provide it to as many other healthcare providers that you work with as you wish. But beyond that, in terms of other types of clinical assessment, I'm very curious to understand from both the multidisciplinary approach as well as the neurology approach, how that works into the patient's overall experience.
I can chime in. For us, it's the same. A patient's information is their information, and we're very happy to provide it to whomever comes into the office. We actually utilize it in our patient education. So we want our patients to be as educated as possible as they're coming into the office, whether or not it's from what is a concussion and how is it managed. Because we're specifically talking about brain health, I'll focus on that. So we go through a series of steps in our concussion management, and every step along the way, each patient knows exactly what their test results are. They know what our direction is moving forward based off of those test results that we got. And if they wanted a compilation of information on all of those test results, we're always happy to provide it to them, because it is their information. We're just a hub where we hold on to it for several years. So I think for us in chiropractic, it's about 7 years that we have to hang on to it. So anybody can give us a shout from, if they saw us 7 years ago, we would still have that information to provide them. And that is their proprietary information. So that is all theirs. But like for us, like I said, again, we utilize it as an education point. So that our patients know that we are taking them on a trajectory, and this is a path, and this is a journey, and this is their journey, and we're just here to co-facilitate that journey.
Yes, as far as I'm concerned, I make special arrangements, leave slots in the calendar so that when a person has had a VoxNeuro, they come immediately to see me, and I give them literally physically a copy of their results. We spend 20-30 minutes going over it, discussing how it fits with their symptoms, and of course already their OT, PT, chiropractor are involved in that and know what's going on.
Right. So actually,
it's everybody knows.
Mm-hmm.
Yeah, and I just on that, so kind of the patient journey then, Dr. Rathbone, I think typically what occurs is a patient sustains a concussion, right? Then they go to a primary care physician who usually refers to you, I'm assuming, Dr. Rathbone, the neurologist. And then from there, for certain types of rehab, if, they want physical rehab or chiropractic rehab, et cetera, is it then that you refer them over to someone like Lauren and team? So just talk to us a little bit about that patient journey, because I think some people may not be as well versed within that.
For us, what happens is we get patients usually referred by family physicians or the emergency rooms.
Oh, okay.
We have our own clinic here, the Live Long Wellness Clinic, which can handle a series of other things, everything from hypnosis through to chiropractic, through to physiotherapy, and we can do counseling and also occupational therapy. But usually the direction is through the occupational therapist. Our biggest problem comes when patients are referred by their family physician, had injury in 2015, please fix. Well, number one, that's going to be a very difficult task. I see Lauren is laughing as well. I think she's got the same problems. And number two, when you say, well, now, do you have any coverage? They say, oh, yes, but I used all that years ago. So this leaves us in a very difficult position because there are lots of things that we can do. All the things that we can do cost money and are not covered by OHIP, unfortunately. So if people use their accident benefits or their benefits from work unwisely, then that is a significant problem. What do you think, Lauren?
I agree. Case in point, if someone comes in from 2015, there is a lot more that we have to work on than just what they're presenting to us with at that point in time. And sometimes it's a multimodal approach, and sometimes the funds available to these individuals, whether or not it is through their extended benefits through work or their benefits through, if there was a motor vehicle accident, for example, through their insurance provider. Some of these don't even come close to utilizing what we, or the funds aren't there to be able to really give this person a very good picture of what we have to do. So, and the treatment is much longer because there are so many different cofactors at that point in time that are going to be affecting that person. There may be psychological issues. There likely would be the physical component. There's going to be the mental component from what we see in terms of brain health, i.e. VoxNeuro. But then the treatment strategies beyond that are going to be different as well. So if, for example, if we have someone come in for a VoxNeuro cognitive health assessment, that costs so much money. Then we have a treatment strategy that goes with that assessment, and that also costs money. And then we also provide neurofeedback in our office. So that also has a price tag to it. And so when an individual only has $500 to be able to spend collectively, because that's what their insurance plan allows, sometimes it will deter the patient from getting that appropriate care. Oftentimes I find that these individuals are also at their wits' end with everything, and they will spend whatever they want to spend, whatever they can spend to be able to get that quality service that they want to get at the same time as well. So there's very polarizing individuals that come in. The person who can only use what is allotted to them, and then the person who wants to spend whatever they can spend to get better. But I hope that in more of these discussions, individuals who are on the forefront of how funds are allocated to healthcare providers like myself and to Dr. Rathbone see the good that we are doing, and that can help and assist in the future as this starts to evolve, because it's not something that we can keep quiet anymore. There are a lot of individuals who are coming in that have been, I'm going to say, for a lack of a better word, mistreated along the way, along their journey. And then they find individuals like myself, they find individuals like Dr. Rathbone, and then we're at a bit of an impasse. We're between, it's a rock and a hard place. We want to be able to provide them everything, but then there's also maybe some resistance that comes with it.
Yeah, no, I think that's really well said. I mean, that's, I guess, more of a systemic conversation and issue that we would have. Something that could probably go on for some time between clinicians, I'm sure, policymakers and whatnot. But, you know, for the last 5 minutes here, one of the questions, again, that we want to raise is, you know, at a more general level, really. You know, I think a lot of the viewers here today are those who have suffered brain injuries themselves, or someone really close to them, or their caretaker, etc. And you know, the question is, what recommendations do you guys as the clinicians have for those with brain injuries to support their overall cognitive health, and how can they put that into practice? So Lauren, I think we can start with you again, if you don't mind, and then I'm curious to hear also Dr. Rathbone's opinion as well on this.
Sorry, Kyle, I was just reading through the question and answers. I was formulating some answers to the questions that were given. Could you, sorry, can you give me that question again?
Interesting. I thought we all had the same questions, but I guess we don't, so I apologize. But it's just, you know, what recommendations do you have for those who do currently have a brain injury on how to support their cognitive health and how they can put that into practice right away?
It's a loaded question.
Yes.
Because I have a very biased opinion and a biased answer to that. Mm-hmm. Find yourself a facility who 100% understands what your injury is. Go to a facility who understands concussion. Go to a facility who understands head injury. Do your due diligence in seeking out what these individuals do. I'll give you an example. My husband, for example, has been an exercise scientist for 30 plus years. He lives and breathes concussion. Our other clinic is in Oakville, and it's a cheerleading facility, and cheerleaders have an incredibly high prevalence of concussion injury. He is the person you want to go and see for concussion care. He sees it every day, day in and day out. So I would say do your due diligence, ask your questions. Those individuals who are going to get on the phone with you to answer questions are the individuals that you would likely want to see, not the ones that kind of shove you to the side and only want you to come in for treatment. Be open to the treatment strategies. Be open to what is out there. Do your research in what is out there. Again, don't be afraid to ask questions about your research and what you've seen, because as much as Google may not be a credible source, there are a plethora of things that we can find there to ask. And one person in the Q&A asked about virtual reality, and we do that in our office as well, as not only eye tracking for eye tracking purposes, but for rehab too. So there's so much out there. So we take all of that information in terms of the technology that we have in the office, and then we streamline, like I said, again, we use virtual reality for eye tracking and rehab. We do treadmill testing for physical exertion. We also have an apparatus in our clinic for strength and power called the Proteus Motion test. I have a Sparta system, which is Sparta science, backed by research to do injury prevention and relative risk of injury based off of testing that we do. And this is all objective. And then, like I said, again, we gather that information, we streamline the process, we co-facilitate in the journey. And we really go to bat for individuals that have been that have fallen down this rabbit hole, and we get it. Well, I've had a concussion in the past as well, probably several that had gone undiagnosed until I was a lot more aware of what concussions were, and I got into a car accident and suffered a concussion. But it was poo-pooed the whole time. No one wanted to talk about it when I got into it in 2012. But it's something that we have to talk about more. It is something that we have to raise our hands about daily. And again, like I said, find those facilities that are going to really go to bat for you, who have focused on what you are looking for. Because you're probably going to get a better overall picture in terms of what you want.
Awesome. Do you have any final commentary to add to that, Dr. Rathbone, if at all? And then after that, we can jump into the question period.
I think the comment I have is, yes, you have to find a facility. The problem is being able to judge the facility. It's the same in any branch of medicine. How do you judge? Do you judge on personality, on the fancy website? Do you judge on this, that, or the other? And so it's very, very hard. I mean, we know that people like Lauren and her husband have spent many years at doing concussion and are excellent at this, but do we know that the person down the road is better or worse? No, there's no way of judging. There's no, there's just nothing to tell us.
Right. No, I think that's also a good point. I think even one of the questions that was raised in the Q&A is, there is no regulatory body for concussion treatment. So how do we know these services have the best interest of patients in place? So Brain Injury Canada would like to answer this question live, so I guess I can leave that over to you to answer that. But at the same time, yeah, it's a great point and something that, I think has to change. And we've spoken about, the change that we want to have. I think now that we're starting to see the technology kind of come in to medicine more frequently and at a higher rate, we could then start to utilize those outcomes that we're seeing to help to change policy and overall, patient management as we continue to grow. So as a collective community. So yeah, I'll leave it there. I'll stop talking and bring it over to you then.
Great. Well, first of all, I'd like to say thank you to all three of you for coming together for such a rich and engaging discussion. It's rare we get to have experts from the different, like the scientist, the clinician, the neuroscientist / educator coming together to talk about this really important topic. So I did mark that we were answering that question live. I'm definitely not the one to speak to it. It's just a way for me to make sure. But I do want to reiterate kind of that having the best interest of patients in place. Kind of what Dr. Karatanevsky said was, I mean, you have to find and check in with those facilities and those clinicians and even caregivers and people and really talk to them about what you need and see how they respond. I think that's an important aspect, but I wanted to turn it over to Dr. Karatanevsky or Dr. Rathbone. How would you address people's concerns about the fact that there is no regulatory body?
Dr. Rathbone, did you want to start on that one?
Regulatory bodies are good and bad. It would be very nice if, in certain ways, if there were a regulatory body. The problem is, as both Lauren and I have alluded to, no two concussions are the same. So it's going to be a little bit difficult having a regulatory body that is going to say, well, in week 1 after a concussion, this is what you do, and in week 2. I mean, we have to do that just like a coach works with an athlete day by day and not setting up a year-long, day-by-day program. We have to see how the patient is doing and what various things are required. Now, it's very difficult then, I think, to get a regulatory body. I think the best thing one could ask is that only treatments for each problem are used that have some scientific background, have been published, have been tested, etc. And knowing that that will evolve with time. What do you think, Lauren?
I was going to, just to add to that, I think it's absolutely true in the sense that it's hard to regulate something when the presentation is so different amongst everybody. And when they come to see us as clinicians, we can see a person in the acute phase of a concussion, or we can see them 7 years from when they suffered their concussion and they're still experiencing their symptoms. What I think we should really what we should focus on is education. Education is absolutely critical, not only from a patient standpoint of things, but from a healthcare provider standpoint of things. The ER should understand what a concussion is and not just have people come in, say that they have something, do a physical test on them that proves that they don't have anything and then send them on their way. So there needs to be everybody's first line of defense, and wherever they may go, there has to be a better overall understanding of what a concussion is, what head trauma may be, and how it goes about being managed at a very, very low foundational approach. Our medical community needs to understand that concussions, the definition of a concussion has changed, the management of a concussion has changed, and that's where organizations like Complete Concussion Management, I believe, are they're on the forefront of being able to educate not only healthcare providers, but the general public. They are a very heavily research-based facility. They take in all of that research and they help myself and my team as providers be able to give the best treatment strategies and outcomes for those that have suffered from concussion or head injury. So I think, it's not necessarily maybe about regulating, but it's more about educating. At the same token, like I said again, and I had mentioned in the past, ask questions. Don't be afraid to ask questions. We search the internet for a phone. We spend hours trying to figure out what kind of cellular device we want and what bells and whistles it has. But we don't do the same thing when it comes to our own health. And don't be afraid to ask those questions. And then you're going to be able to see what service provider is going to be able to facilitate your care or one that isn't. And if it's not that person, you have to find alignment. You have to find alignment with your healthcare providers because, like I said, sometimes it is a journey and it's a long one. And so if we can spend all of the time, like, again, researching. I mean, I think I have a 2-year-old daughter. I have spent countless hours researching different technology for her to use. It's crazy that we would do something like that for a little leapfrog pad, but we won't do that with respects to our own brain health. So ask your questions, be brash about it. Anybody that's going to end up, I am happy to sit and talk to anybody who wants to end up talking about the path and the journey that they want to go on with their care. So if you can find people like that, that they've got your best interest at hand.
Excellent, thank you. Yeah, those were, it's definitely, like you said, it's all different. Everyone has a different experience and presents with different needs. And so being able to regulate that can definitely be challenging for sure. Another submitted question was, what about doing an analysis via ADLs and subsequent recovery? I'm not totally sure what the acronym is, but is it familiar to any of you?
ADLs are activities of daily living.
Oh, perfect. Yes. All right. I'm happy to open it up to anyone who would like to answer that question.
Well, one analyzes activities of daily living with the occupational therapist. And that is one of the first things to do. Now, this does not tell you, however, how the brain is functioning all over. It tells you how the person is able to handle the activities of daily living. And for example, we know that almost everyone who bangs their head manages to get low mood and anxiety. And that's been shown in many, many papers, most recently by Bailey out of Toronto. So we're not addressing that. That low mood can affect pain perception and it can affect cognition. So all of those things are muddled up. So just by finding somebody can't do activities of daily living, very important, but let's also go back and find out what is causing it so that we can put those right as well.
Yeah, just to echo that, I can say the same thing. So we utilize one's activities of daily living as another tool to see how well they're progressing. So in our strategies, we have return to work, we have return to play, and then we also look at their activities of daily living as well. So we facilitate, we use that as another tool to see how well they're progressing and whether or not they're symptomatic. If we return them back to that type of physical exertion that they may be performing, whether or not it's in any of those areas. So again, we use it as a tool, not as a standalone, but it is combined within all our assessments.
Excellent. We have another question from our audience. Are there any applications for those who are autistic or bipolar? Dr. Reiter, do you want to speak to this?
Yeah, for sure. So in terms of our current, clinical product, there is ability to assess quite literally everybody. We can assess the cognitive function of an individual's brain. So as what Dr. Rathbone mentioned earlier, it's not a diagnostic tool to say, an individual has autism or does not. But we can assess an individual with autism and understand what their level of cognitive function is. That's what we can do. So when it comes to that in particular, and sorry, what was the other part of that question, Rachel?
Bipolar.
Bipolar, right.
Bipolar.
Okay, so we actually have started some studies with St. Joe's Hospital in Hamilton regarding bipolar and understanding those differences in cognitive function relative to healthy individuals from a more high level perspective in terms of the literature. Yes, there's very much clear differences between individuals who have been diagnosed with bipolar and those who are considered to be neurologically healthy. So it is something that, again, VoxNeuro technology is able to assess the cognitive function of, but again, not to determine if they have bipolar or if they do not.
Another question that was generated was, we talk a lot about the patient, but especially in brain injury, it's not just the patient. There are family members, friends, caregivers, loved ones. So with these new technological assessments and technological advances, how are caregivers integrated into that process so they can best support the patient both through the process and after? Like, I liked what Dr. Rathbone said about, I've handed them this physical piece of paper. So how are caregivers integrated? And perhaps either Dr. Karatanevsky or Dr. Rathbone from the clinician perspective could speak to that.
I can jump on that question. So in our office, if we do have a minor come in that has had a concussion, usually they're accompanied by a parent. And we provide the same education that we provide to the patient that we do to the parent or caregiver as well. We as well, like Dr. Rathbone was saying, when I go through a cognitive health assessment with a patient, they are going through it with me and they're asking whatever questions come up while we're going through the assessment. As well as we have other handouts that we give to our patients as well. And we discuss how we can educate everybody on understanding what is going on so that it is not only we as the provider and them as the patient who are getting the necessary care, but how as a collective unit we can make sure the recovery of the person is better.
Yes, I'm entirely in agreement. I think it's important to recognize that there is no person with a brain injury sort of in isolation. People are in society. They have to interact with their spouses, children, parents, co-workers, whoever. And so this is where some sociology is really, really important, because two people with apparently similar injuries can have very different outcomes depending on their supports, depending on how they interact with others. So I'm always very happy to have an extra pair of ears sitting in with the patient. And I'm always happy to discuss with the patient and their significant others in this group, be it at work, be it at home, be it parents, whoever, friends, what is going on with the patient and how they're interacting with these other people, because that interaction is critical for recovery. So it's very important everybody understands that. That's my 2 cents.
Excellent. Oh, that's really great. Thank you. I think we have time for one last question. So, and Dr. Karatanevsky, I believe it was you who said when you're using technology, it helps take people out of the box. That has become just through, past definitions, a very standard definition of what, let's say, brain injury is. And it takes people out of that box. So, and I'm not sure how much interaction you have after someone leaves, completes their treatments with you, but how are other healthcare providers who may be involved in care teams reacting to and using this new, almost higher level of information?
Our stance on that, if we're not physically treating the patient ourselves, is that we act as a facilitator. So, and because of, it's interesting that we're having this conversation because of all of this technology. I've developed with my husband's assistance a new high performance testing system that not only includes brain health. So we have our cognitive health performance testing systems, and then we have our high performance testing systems. And that all funneled because of what we believe technology can offer us. In that particular case, I take all of the information. I did this most recently for someone, a medical doctor who wanted me to do a cognitive health assessment on their patient. I sat and conversed with them after the patient had completed their cognitive health assessment. And then I offered up my thoughts on what they currently had as treatment strategies and whether or not they aligned well with what the results were of that assessment. And I'm really there just at that point in time when it does deal with other healthcare providers to just be a soundboard and to see whether or not they have the resources to be able to assist that person going forward. And many of them do. They may be different than what we do. And it's not to say what we do as a clinic is the end all to be all, because then that just boxes everybody right back in again. And I definitely don't want that for anybody. So we, like I said, long story or question answer short is we act as facilitators and guide and guidance counselors, so to speak, in that person's recovery.
Excellent. Well, I think that about wraps up our time today, but I would really like to extend a very sincere thank you to Dr. Reiter, Dr. Rathbone, and Dr. Karatanevsky for all their time and their insight today, as well as another thank you to our presenting partner and platinum sponsor, VoxNeuro. Again, this recording will be made available as soon as possible, and we thank everyone who was able to join us today. And thank you to the three of you for such an interesting and important discussion.
Thank you very much, Rachel.
Thank you for asking us.
Absolutely. No, it was really great. Excited to watch the recording, and I hope the viewers enjoyed it. And again, thank you to Brain Injury Canada as well as you personally, Rachel. So thank you.
And thank you to those that asked the questions. They were wonderful.
Absolutely. Awesome. All right. Thank you, everyone, and hope you have a wonderful day.